And we're going to be talking about a lot of different subjects, but I want to start out by asking you guys a question. What is the most people's thoughts or approach or philosophy to lifetime care? You can give me yours, but what do you think it is in our culture?
I think people don't think about it until they get sick.
That's what I was going to say.
Boy, that's the truth, right?
Fix it after it breaks.
Fix it after it breaks, yeah. Yeah, I would say that is probably one of the main things, for sure, okay? So, if it doesn't hurt, there must not be a problem, which is sort of the flip side of what you guys just said. Doesn't hurt, not a problem. So let me ask you a question. Has anybody ever known anybody who felt pretty good and then the next day they fell over of a heart attack and died? Yeah, I know people like that. How about this one? They felt good, they didn't have any symptoms, went to the doctor checked them out and said, hey, there's something here we need to look at, and they had late stage cancer. Anybody ever know anybody like that? Yeah, I have a friend like that at church. He was fine. He didn't have any symptoms. Thought, I should just get checked out because I haven't for a while. They checked him out, and he had third stage kidney cancer, and in 3 days he was in the hospital having his kidney removed. He had no symptoms at all. So is this a good approach to health, to lifetime health? No. Symptoms don't necessarily, if you lack of symptoms, don't necessarily mean that you don't have a problem. Breast cancer grows for 10 years before you can even see it on a scan. Okay, 10 years. Okay, so let me ask you this. Let's say you're in a foreign country. This actually happened to me. And you get you drink the water, and you get sick, and you start vomiting, diarrhea and vomiting. Is that bad or good? Is your body working like it should? Or is that a bad symptom or a good symptom?
It's a good one.
It's a good one, that's right. Why is it good, Patricia?
Because the body knows that what's in the stomach is bad, so it's purging of the toxin that's in whatever you eat in your drink.
So it's actually a very healthy response considering the circumstances. So that means your body is working like it should, okay? So we can't always base our health on symptoms, all right? How long does it take for a disc to degenerate in the spine? Anybody know? Not 25 to 30 years, between 20 and 30 years, okay? You don't even know what's happening. I mean, I show x-rays of people all the time with degenerative disc disease. They had no idea they had it, okay? Happens all the time. So if it doesn't hurt, there must not be a problem. This is not a basis for sound health care. So that's like saying if your car doesn't have a seized engine, do you change the oil? Well, of course not, You change because you want the car to run well. And as human beings, we want things to work their best too, but not everybody's willing to pay the price for that. And we all want things that are safer, that work better, more effective. But that doesn't always mean that people want to pay the price. So anybody ever accused you of being like a health nut? Anybody in here been accused of that? You have, okay. So how do you respond to them? How do you respond to that?
I probably just think they're nuts. They're nuts.
So
They don't care much about their health. Because I learned that if I say anything, somebody can't hear it if they're not ready to hear it.
Yeah.
And so I just go, well, this is just what my body wants. So.
Okay. I just say, well, what are you, a disease nut? That's my response. Are you a disease nut? What else can you say? So, and sometimes it's true with chiropractic, they go, haven't they fixed you yet? Are you still going back, even if you're not, even if you're pain free? So we're designed from a blueprint of health. And the blueprint is really the spine. And when subluxations are present, that affects the blueprint of our health, whether we're able to feel it or not. And the degree to which we reflect this blueprint is determined by how we take care of ourselves and how we take care of our spines. So we don't exercise today to avoid a heart attack tomorrow. Why do we exercise? You ready? But there's nobody exercising here but me. Why do we exercise?
Long-term health.
Yeah, long-term health. It enhances our daily life. Even the meals we eat are better when we exercise regularly. We don't read to fix our brain. We don't read today to prevent a headache tomorrow. We know that when we keep our brain healthy by reading and by doing things that stimulate the brain, that our brain doesn't deteriorate as fast. And that's a reality. That's a truth. So that brings us to our discussion of lifetime care. And a lot of people don't engage in this conversation. It takes a certain level of evolved thinking to even to realize that you don't respond to your health when even when there's not a crisis, okay? You don't respond when there is, you don't just respond when there's a crisis. So so important point number one is that just because it doesn't hurt doesn't mean there isn't a problem. We don't respond just because it hurts. Okay, the second thing is lifetime care is not an outcome, but it's a process. All right, so anything that we do that's a virtue is really a process. So when are we going to be done exercising?
Never.
Ever. Never. Right. So I know people that are in wheelchairs that exercise with really light weights, okay? Now I hope I'm never in that position, but I know people that do. When are we going to be done eating the right food? Hopefully never, okay? When are we going to be done brushing our teeth? I mean, we finish that at 50? Yeah, I'm done. Yeah, 50 years old, I'm tired of it, you know? No, we want to, I don't know about you, but I want to hang on to my teeth until I'm dead, okay? I want them to go to the grave with me. When are we done praying? At, 45? I mean, when are we done loving our family? So anything we do that applies the virtue of existence is a process. And that includes our health. So some people, when they start chiropractic care, they say, do I have to go the rest of my life? No, you don't. You can quit any time. The thing is, why do people continue chiropractic care even after they're pain-free? Anybody? Why do they do that? I mean, I don't have any chronic pain at all. I get adjusted once a week. Sometimes I go once every 2 weeks, but mainly once a week. Well, why would I do that? I don't have any pain.
Just maintain quality of life.
Yeah, quality of life. You want to maintain a high quality of life. So here's a story I want to tell you. This girl's name's not actually Sally, but she was a patient of mine. So because people can't make sense of that, you go to the doctor even when you're feeling good to keep yourself feeling good, to keep yourself feeling healthy. So this is a young lady that came to me. She was 22 years old. She's in a car accident, and I saw her for 3 months and dismissed her. And at the end of the care, at the last visit, she said to me, is this a coincidence? She said, I noticed that since I've seen you for 3 months, I no longer have long, painful menstrual cycles. Do you think that's a coincidence? No, I don't think it's a coincidence. That was the only thing she did different. So why would chiropractic care help that? Why would what I did help that?
Probably because it takes pressure off of the nerves so that whatever organs the nerves are going to function properly because they're getting the right signals back and forth.
Yeah, that's right. So do the ovaries and the uterus have a nerve supply? Of course they do. Yeah. So you know, she probably had some long-term stress in that area, and we fixed that, and she got better. I didn't even know about it until she told me about it right at the end. So this is one of the reasons like insurance companies don't want to pay for wellness, because with sickness, they can form a mathematical equation that says this person should have their symptoms gone in this amount of time, which I think is even a little bit ridiculous because everybody's so different. I mean, men are different from women, they respond differently, their bone structure's different, their muscle structure's different. How can you do that? But that's the way they think. So wellness is infinite. So insurance companies don't like to pay for wellness because they don't know how to define it or measure it. So I'm going to ask you guys a question. How would you define wellness? Anybody in here? How would you define wellness? Nobody knows.
The absence of illness.
Okay, so the absence of illness, so what would that mean exactly?
Feeling good and be able to do what you want to do.
Okay, so function,
Function. Yeah.
high function.
Yeah.
Okay, that's pretty good. Okay. I would define it, anybody else want to take a shot at it? Nobody, okay, not even my employee. Okay, so I would say that the systems of your body are working at the highest capacity possible. That's how I would define wellness. And all of the systems of your body are working as well as they can, okay? So I want to talk a little bit about ligaments because we work with that a lot when I work on you. And when I have you do your neck traction exercises, we're working with ligaments, okay? So what does a ligament do? What is it? What does it do in the body? Other than hurt real bad when you tear it. What does it do?
Attaches muscle to bone.
That's a tendon. That's not a bad answer. That's a pretty good answer. Tendons attach muscle to bone. What do ligaments do?
Bone to bone.
Right. They hold bones together. Ligaments hold your bones together. They're incredibly well innervated, which means that they hurt real bad when you tear them. Okay? And that's why when a football player gets a ligament torn in his knee, you don't see him getting up and running back to the huddle. He's down writhing in pain because ligaments are so pain sensitive. So when a ligament is torn, ligaments do not have a blood supply, but they have a very good nerve supply. So when they heal with scar tissue. Now scar tissue is like taking a bunch of toothpicks, dropping them on the floor, and that's how torn ligaments heal. They heal very haphazardly. So when you tear a ligament, like in a car accident, it heals, it's a lot weaker, it's a lot more prone to pain, and it's a lot more prone to re-injury, okay, because they heal haphazardly. So here's a pre-injury, here's a healthy muscle fiber, pre-injury, and then here is a muscle fiber that's healed with scar tissue. Now muscles actually heal a lot better than ligaments because they have a much better blood supply. But when you tear a muscle real bad, it will still heal with scar tissue. So that's why ligaments, that's why it takes time to change the curve in somebody's neck, because when you've got somebody that, let's say they had a car accident when they were 18, now they come to see me and they're 50 and they reverse curve in their neck, those ligaments have shortened and hardened. So that's why it takes a lot more time, and it's somewhat uncomfortable to change that curve in the neck because you're trying to stretch those ligaments out to be able to get that curve to come back. Okay, so another type of problem is what we call ligament creep, and this is from bad posture. So if somebody's doing this all the time, which is about like all of the kids in our society looking at their phone and their tablets, over time what happens? The neck deforms to that position and the ligaments hold it there. That's called ligament creep. Now that's not an injury, that's a postural issue. but you're still working with the same thing when they come in to see me. So research shows, this is really good research, shows that for every millimeter reduction in forward head carriage, so every millimeter that you bring the head back like this to a normal position, there's a measurable change in neural integration, in cognition. In other words, your ability to think, and in hand-eye coordination. This is a great study. This study was published, I believe, was published in a journal called Scientific Reports, which is a really hard journal to get into. And they find that the more your head comes back to normal, the easier you can think, and you have better hand-eye coordination. Now the NFL ought to get on this, okay? They ought to, because this really is important for sports. So what is neural integration? So neural integration is a state where your nervous system is able to coordinate all your body functions to create balance and sustain health. Well, you do that a whole lot better when your head is sitting on your shoulders. And that's why I give people neck exercises to do at home to help their neural integration. In effect, forward head translation causes loss of hand-eye coordination and increase in falls. Current statistics show that 42% of adults over 55 years old in our society will die as a result of complications of falling. So if I can prevent that, your quality of your life is going to be better. So I'm trying, by bringing your head over your shoulders, by giving you those exercises, I'm trying to prevent you from falling because this is a big deal. Now, why do people require hip and knee replacements? You ever wonder about that? Why is that? Now there's some that are obvious, but some that aren't. So why does somebody that goes through life, one of their knees wears out, and the other one seems to be okay, and they're the same age? Why is that?
Could be genetics, weight bearing.
Okay, and what affects weight bearing?
Well, your diet, your health, but then too, like maybe one person was a mail carrier and walked 20 miles a day, and the other one worked at a desk and didn't use their knees much at all. So joint use. Okay,
And mail carrier with a bag on one side, walking like that all the time. Yeah. So postural issues for sure would cause that. So definitely. So we would say distortion of the structure. Would you agree with that? Structural distortion. Okay. What else? But you also hit on something else that was really good. And what else, Larry? Because you said something I thought that was really important.
Just the weight, the capacity, your bones are only designed to carry so much mass.
That's true. And you said something else. Diet. Okay, so what about diet? What does diet have to do with a knee replacement or hip replacement? Anybody?
Either getting or not getting the proper nutrients to feed the cells and have them function properly.
Okay, that would certainly be part of it. Okay, definitely.
Inflammation of your joints.
Oh yes, there you go. That's what I was waiting for. Inflammation. Bad diets cause inflammation. So if your body's constantly inflamed, and then you're subluxated, so you're not carrying your weight properly, so maybe you have 5 pounds more on one side of your body and you don't even realize it, and you walk around like that and you're constantly inflamed, is it possible that maybe your joint's going to wear out a little faster? Yes. So one of my goals with my patients, and I can't say that I always accomplish this, because sometimes you can get injuries in a joint that just cause it to degenerate faster. But I want to save people as much as I can from joint replacements. To me, that's part of lifetime care, is caring for your joints so you don't have to have them replaced, okay? And I see it so much, and I can't understand. Well, I do understand it, but I think it's a tragedy. So I want to talk about x-rays. Like, I've had some people really question the the safety of x-rays. So I want you to really understand this. This is some really good research here. According to the EPA, the average diagnostic x-ray delivers 0.04 REMS. REM stands for radiation exposure to man, okay, to the body. According to the National Council on Radiation and Protection, the annual limits currently are 50 REMS a year. So that would mean that you'd have to get 1,250 medical x-rays to even reach the limit, okay? So when I send a person out for 5 x-rays, that's almost nothing, okay? In fact, what the research shows is that small amount of X-radiation is actually good for the body. It creates a stress response in the body and actually causes the immune system to get a little stronger. Now, it's just like working a muscle, okay? When you work a muscle, you tear it down a little bit and it gets bigger. Well, that's kind of what X-ray does. X-ray actually causes the immune system to work a little bit better. Now, back in 1980, when I graduated from chiropractic college, we didn't know that. We thought, X-ray was a lot more dangerous then, or a lot more harmful than now. We know a lot better, okay? So a dose of 100 REM all at once will cause nausea. That's 2,500 medical x-rays simultaneously. Okay, a CT scan is 30 REM, 750 x-rays. A dose of 1,000 REM all at once will kill you, but over a period of several weeks. 3,000 REM is a typical dose to kill a thyroid tumor, but you're only zooming in on one little spot, so it's not whole body. So I just want to put this in perspective for you. When I send you out for x-rays, you're getting, and the x-ray machines now produce way less radiation than they did like when I got out of school. So they're not harmful. That's the point I want to make. So important point number 3. Caring for your body or health care is something that you do at certain moments and not at other moments. So I would say this: we render care to our body at every moment, and even our thoughts, the way we think, constitute care. So here's everybody hear of Hans Selye. Anybody hear that name? Nobody knows that name? Hans Selye is very famous. He's the one that discovered that stress affects the body and how to measure it. It was Hans Selye that did it. And what he proposed back in the 40s is that even the thoughts that we think can cause stress to the body and accelerate disease. That was a really radical concept back then. And we know now that's true. So Reiki Hamers, a German physician, in the early 1980s produced scientific proof that every cancer has a negative emotional origin, and specific diseases have specific emotional traumas associated with them. And so he mapped that all out. For example, people that have unhealed grief and sorrow tend to get more lung disease. People that have indigestible anger that they can't get rid of tend to have more stomach and small intestine disease. People that have starvation of love tend to have liver issues. The liver also goes with anger and resentment as well. And he found that he could pinpoint all of these on an MRI of the brain, and he categorized it and was very successful in treating patients with cancer. And the reason he discovered this is his son was vacationing in Italy and was murdered. And he was in so much grief that 6 months later, he got testicular cancer, and he'd been healthy his whole life. And he realized there had to be a connection between his son's death and his testicular cancer. And he realized over time, when he was going through patients' records, that sudden loss of a loved one can cause cancer of a reproductive organ, and that's what happened to him. And he was able to get healed from that because he figured that out. So we render care to ourselves all the time. How about the beverages we choose to drink? Okay. Are there any bad beverages?
Yeah.
Yeah, there's really bad ones out there. Like, yeah, like what? Soda. Yeah, soda is toxic. It's a slow poison, but it's nevertheless a poison. Whether or not we choose to exercise. So if you choose not to exercise, you're still rendering care to yourself. This is not very good care, but you're still rendering care. The food we choose to eat, how much we chew our food, which I fall down pretty hard right there if you want to know the truth. Whether we smoke cigarettes, whether we drink too extreme, whether we have limited sugar or too much sugar. I know none of you have ever had too much sugar, but there's people out there who have, okay, just so you know that. Whether we consume artificial sweeteners which damage our nervous system, all right? Are we rendering care to our body? What about when we're sleeping? What does the Bible say about going to bed angry? You know, we're not supposed to do that. Okay, so we go to bed angry or we go to bed upset. What happens? That can percolate in our mind like all night long. And so we render care to ourselves all the time. It just depends on how aware we are that we're doing that. So lifetime care is not a choice. The only choice is what quality of care you're engaging in. So if a friend asks you, are you still going back to that chiropractor even though you're out of pain? Maybe the question should be, what are you doing to take care of yourself? You know, what are you doing to care for yourself? So, I'm going to skip this. This is some stuff on COVID. So the chiropractic adjustment is the most efficient and fastest way to stimulate the immune system. 21 published papers were found that explore the impact of chiropractic adjustments on the neuroimmune markers. 18 to 21 of those papers found a significant effect of the chiropractic adjustment on the neuroimmune system. So the same article states the following: studies have shown that chiropractic adjustments positively impact various aspects of autonomic nervous system function, cardiovascular, respiratory, GI, and genitourinary. So here's the important point number 4, and this is the last thing that I'm going to talk about. My back pain or my health issues should be able to be corrected quickly with just a few adjustments. Can a lifetime of slips and falls, auto accidents, no matter how insignificant, bad posture, poor diet, significant stress, be corrected in a few days or weeks? So here's how I want you to think about that. What if over a period of 10 years you gained 100 pounds? How long would it take to lose that?
Couple weeks.
Yeah. I doubt it, okay? I doubt it. So it might take a year, okay? A year to lose it if you really worked on it. So I've had people that didn't get better right away. In fact, I had a young man who, he's 40. After the first 6 weeks of care, I did his re-exam on him. I asked him about his symptoms. He had about 4 or 5 of them, and he had some chronic issues going on. Not one of his symptoms was better after 6 weeks. Not one. Now his function was better, his grip strength was better, range of motion was better. And I asked him, I said, what do you want to do? What do you want to do at this point? And he said, I want to go another 6 weeks, which kind of shocked me, you know? And so we kept working on him, and probably in the next 3 weeks, his symptoms got radically better. And now he functions really well. But if he had quit after the first 6 weeks, he'd have never gotten better. So you don't always get better right away, okay? Sometimes it takes time. Some people do. I see some people, another guy came in with chronic migraine headaches. They were gone in the first week of care. I didn't know that was going to happen. And he's hardly had any since, okay? He has some other issues that we're working on. but the thing he came in for, migraine headaches were gone within a week. And so we can't always tell what's gonna happen. So your back issues your health issues can't always be corrected quickly. Sometimes they are, sometimes they're not. Sometimes they take time. Sometimes some things can be corrected pretty fast. What about rendering care to kids? Children generally respond pretty well to chiropractic. And they don't have nearly as much degeneration and lifetime of problems that we have. So my request to you, as your doctor of chiropractic who takes care of your spine and nervous system, which controls all your body functions, is to just think about things, do your spinal exercises, practice workplace ergonomics, and I would say exercise and eat right. And that's I have some more slides, but that's all I'm going to cover tonight. That's enough. Does anybody have any questions? Anything I've gone over? Clear as mud, huh? Okay.
I think it looks good.
All right, good, thank you, yeah. So, some of you may know some people who have chronic illness that can't get rid of it. You know, send them in, let us take a look at them. Let's see if we can help them. I don't feel there's any need for people to have to live in pain or people to have to suffer. And some of the problems I've seen, like I've seen multiple people with chronic diarrhea that couldn't even leave the house hardly. We're able to fix that, doing some of our protocols. So a lot of people with pain. So we would love to see those, at least consult with those people and see if we can help them. Otherwise, that's all I have tonight. Thank you for taking some time out of your life to learn a little bit more about your health. The next talk we're going to do is on, I believe it's September 9th, and we're going to have a guest speaker, a good friend of mine, Dr. Lynn Erickson, who's an expert on posture, who's going to come in and talk about posture and health. So he'll be talking as a guest speaker in a few weeks. But thank you so much for coming tonight, and God bless you, and stay healthy.